Hello, everyone, and welcome back. It's episode 2 of A Foundation of a Healthy Smile podcast. And with me, we welcome again our expert and friend, Dr. Mariki Weekly. Welcome again, Doc.
Thank you. It's good to be back.
Yes, and today we're talking teething.
Yes. Very
When
interesting
does
topic.
it actually start? Yeah, and it's quite a vast topic, eh?
It's a very vast topic. Teething basically starts when the baby is still in mommy's womb. It starts while mommy is pregnant, and people don't realize that things that go wrong during pregnancy can actually influence the development of teeth. So we need to be healthy as moms, pregnancy. And then, of course, if we're talking about when does the first tooth appear in the baby's mouth,
specifically, yeah.
we're looking at about anything from 4 months.
4 months.
Yes, and then sometimes a baby can be a year old and not have one tooth yet. So there's a long range of normality.
Yeah, so it's important what you are saying, a range. You know, I
Yes.
always emphasize that
Yes,
because parents tend to compare.
they do it. Even
Right.
in the same family, it would
Yeah,
be different.
yeah.
Yes.
Or they will go like now for babies immunization at the clinic, and they're sitting there. Oh, so your baby does, already started teething, and now you feel like your baby's delayed or anything. So it's important that we notice there's a range to it.
Very much so.
There's a range to
And
it.
the range is normal. Very often we find that if a baby had a first tooth very young, very early, like let's say 4 months, they might start losing their first baby teeth at an earlier age.
Yeah,
For instance, at 4.5, 5, although
we've seen it.
mean age is 6.
6 to 7.
But we have seen children that starts earlier.
Yeah, to shed the
Yes,
the,
to
the
shed the baby
teeth. Yeah,
when they had their first tooth earlier.
yeah.
Yes.
And I think it's of utmost importance what we've just shared also when we started the podcast, to say, it's important what we take in as parents, because it's just not about yourself, it's about the baby. And we never think that far, to the point of teething.
Yes, you think you're eating healthy food as a pregnant mom.
Exactly, right?
For the baby,
Yeah.
but you don't think about
goes
the
beyond
teeth
that.
of the baby. It's as important as for the teeth as for the rest of the body to eat a healthy diet when you are pregnant.
Yeah. And things can go wrong in terms of the development, like we say, if you're not eating the right stuff, the correct diet. A lot can go wrong. The question that we get a lot is from parents: how do I know if my child is teething? What are some of the signs and symptoms?
Yes, because some children go through it easily.
Yes, that's the
and
thing
the
about it.
parents just
It's
say
not a
when
straight.
Yes, it's never straightforward.
Forward thing for everybody.
But there can be children that get very irritable. Of course, we always see babies with their hands in their mouth, or they put everything in their mouth.
Which is not a good thing.
Yeah,
Everything in the mouth.
Not everything, yeah.
We don't want to
We don't
disturb
want
the form.
everything,
Yeah, no, we don't
yes.
want everything.
But when they start teething, it can also cause itchy gums, and they want to chew because it helps the teeth to feel more comfortable to come through.
So what I often get also is the question about diarrhea.
That's a common one.
Yeah, but it's not really the teething that causes diarrhea. It's the stuff that that they take in. Like we say now, sometimes they take in everything, and it will.
Yes, it can be also that the immune system is also a bit compromised, and then it can cause a bit of diarrhea, but it's not directly linked.
I think that's the most important thing that the message we want to share with the parents, that is not directly linked to to teething.
Definitely not. I think often things like kids drooling is a very important sign, and the
That's
drooling
a
can
common
be quite
one.
bad. Yes.
Yeah, that's a common one.
Also, I find some advice that I normally give parents can be to chew on a little ice lolly, or you can make healthy ice lollies with fruit and ice it, and then they can chew on that.
Yeah.
Or I think the teething rings are also quite good
Oh,
if
yeah.
they're made of a good substance. And also, I always find that if it's cold, it's better.
Sure.
If it comes out the freezer.
You're taking me back, because I'm a dentist, but I'm also trying to think that time when I had my baby's teething.
Yes.
I was trying to think what I used to do. Hey.
Yes.
So basically, I think also what works for you as a parent, you will know your child. That will give them relief, give them the comfort.
Yes, I that you talked about your babies. What I think was very good for my kids was to give them some biltong.
Oh, you see now,
South
mommy's
Africa,
recipes,
yes.
right?
You give them biltong,
Yeah.
not the parts that are one that's already cut into pieces, but the
okay.
one that they can chew on and chew on and chew on and chew on.
Why I never thought about that, but
That's a good tip.
it's too late for me now.
Yes, yes.
But our parents can benefit from that tip.
Yes, it is a good. It helps the child to chew on something. It's also something salty, and it's help with the itchiness of the gums.
Yeah.
That's what I find. Just for our international listeners, biltong is a South African dried meat, but it's like jerky, just much nicer. Come to South Africa.
We love it.
Some of the problems that parents often ask about is the irritability of the child when they're teething, and they're also not sleeping well, which is a problem for the parents as well. And what I also recommend when you get swollen gums, for instance, is you can put a bit of teething gel on that you get at the pharmacy.
Yes.
And you can also take some syrup, banana syrup, just a little bit, and rub it on the gums. So I think irritability is definitely
it's a problem.
Yeah.
For both.
For both.
Definitely for both.
The parents and the child.
Yeah. And where does it start? Is it the upper jaw, the mandible?
I think it mostly starts in the mandible. Yes, so the lower teeth will erupt first. Again, with the sequence of eruption of teeth, it's very different. There's a normal sequence, but then there's also it's not always followed. So people don't have to worry if the maxillary anterior teeth are the first teeth to erupt. It's fine if it's in a different order. That's very important to let nature take its course.
That is so important. I always also encourage that.
You can't push the teeth out. You can't rush them. One problem that I don't know if you have found that, but you get what we call an eruption cyst.
Yes, that little boliki.
Yes, it's like a
on the gum.
On the gum, it looks like a blood blister, like a blister on the gum. And that is very painful. Have you had patients with that? Yeah,
we've had patients like those because obviously then when during birth, and then the parent, they notice that's this. So we always encourage that you bring the child.
Yeah, and they often will have a fever, and they will not be able to chew or drink because of the eruption cyst. And it's something that normally goes away by itself. We encourage the parents then to give the kids hard things to bite on, so that the cyst can open by itself. Very seldom we have to open it.
Yeah, very seldom, but sometimes we have to help and sort of like best it and open it.
Yes. Yeah. I've had to do that once.
Yeah.
Open it.
Yeah.
So.
But look, it's nice to work with babies because they're so small. The only thing they do is just to scream. Then you whack. They're not kicking and they're not at age 3, 4 where they're
really too strong.
Yeah, they're too strong. So
And it's good that they scream with their mouth open.
You see, that's what I'm talking about.
So we can see what's going
Yeah,
on.
yeah.
Yes.
But now that you mentioned the eruption cyst, it reminds me of the, what is that, neonatal tooth?
Yes, we should speak about that
yes,
as well.
especially now that we're talking teething.
Yes, so that's some babies are born with 1 or 2 teeth in their mouths, and we call them neonatal teeth, but they can be a choking hazard. So we have to remove them as soon as possible.
And another thing is that also mommy cannot breastfeed nicely because,
of course.
I mean, we're not expecting to have any teeth in there.
Yes.
So for a breast, it's like, okay, who's there?
It's not
right?
working.
It's not working.
I hear you. Definitely not.
Knock, knock, who's there?
No.
It's a tooth.
It's a tooth. But it shouldn't be there.
But it shouldn't be there.
Yes, so it's not that difficult to take those teeth out.
We normally just numb that area.
Just the surface?
The surface, and they're easy to take out.
They are easy to take out.
But it's important that the parents and the caregivers, they are aware that this can happen.
Yes.
And like you've said, we don't want to run the risk of the child choking on the tooth because they're not that strong.
Yes.
So if you say
if
you
they
need to go
cry
and
a
consult
lot,
immediately.
if the babies, they can cry a lot and they breathe into their lungs, then they can breathe that little tooth in.
Yeah. So as soon as you notice it, you need to visit the dentist.
For sure. You can find when a little baby is born and the mom can't breastfeed, it can be because of a lip tie or a tongue tie. Have you had any experience in that?
Yeah, absolutely. Because then the shame, it's such sometimes a sad thing for parents because they so much want to breastfeed.
Yes.
But it's just not happening because of that lip tie, tongue tie, because then it affects that suckling.
And the moms blame themselves,
but
then they are. So what happens? What's very good is when they go to lactation specialists when the baby is so young, and the lactation specialists are trained
to detect
the tongue tie or the lip tie. It can easily be snapped, or we use laser. Yes, we use laser just to take that little tongue tie or lip tie away. And that should be done within the first few days.
Yeah, as soon as
baby's life.
You notice it. Oh, thank you so much, Dr. Marike, for joining me.
Always a pleasure.
So to our viewers, next week we will be talking about something very close to my heart, which is the Kids Dental Home Foundation. So please make sure to tune in.